Hello, my name is Nick Clausen with Denner Laser Coaching, where our goal is to make the complex simple and transform your practice utilizing dental laser technology. This is the second series, Presentation 2. If you haven't had a chance to watch the laser physics presentation, please stop now and just hit your back button and go back to that presentation and view it. If you do this presentation, you'll get a lot more out of it and it'll really help you. That goes over the laser physics, how the laser works and what's coming out of the laser and how to manage that. So what we're going to talk about today, now that we know that, is the laser tissue interaction, the operating parameters, the techniques, and the type of lasers that are out there. So with that being said, I hear this a lot. Which laser do I use? And one of the primary things that we need to consider is chromophore. I'm going to go back to the plants of the world. And we think about that, a chemical group capable of selective light absorption resulting in the coloration of certain organic compounds. So certain plants have certain colors or affinities, and the same thing happens with lasers. Lasers, specific wavelengths, different wavelengths, have different absorption characteristics when they interact with different things, and we've got this down to a science and we know some of these things. So if we look at this and we look at the dental laser wavelengths on the electromagnetic spectrum, we've got all these different types of lasers that are primarily used in dentistry in the past. Some will be used more in the future. Some are being used today. But why were these wavelengths selected? And all these wavelengths are different. So what I'm going to do is I'm going to put it in an absorption chart. Now, again, I'm going to highlight here, this is an approximate, and this laser isn't exact to scale to the precision of a very, very, very detailed chart. What I'm trying to do here is give you the idea of how these lasers works and talk about the primary components that are used in dentistry. So with that being said, we're going to use this dotted line here as our baseline. Everything that's above this, and the higher we get up here, the more absorbent it is with a specific wavelength. So I'm going to start with hemoglobin. We're going to put hemoglobin out here, and as you can see here, it starts to absorb in the ionizing realm, but it goes into the visible spectrum and then into some of our infrared or thermal. And you can see here we also have melanin. Now, why I have these two together is because what these two characteristics are the primary interactions, what we call soft tissue lasers in dentistry. And most soft tissue lasers are here around the 800 to 980 range. And as you can see here, the melanin in hemoglobin at 800, it's absorbing, it's above the baseline that we have here. And as we scoot over and get into the 980, it is even more absorbent in melanin or hemoglobin, or excuse me, just with hemoglobin. As you go into the 980, it's less absorbent in the melanin, more absorbent in the hemoglobin. Now, just to note here, the hemoglobin, there's some charts out there that have oxygenated hemoglobin. There's things that are calculus. I'm just going to keep to the basics here so that you get the idea. So you can see our diode laser technologies are seeking blood. The more vascular the tissue, the better the laser is going to work, and the more pigmented the tissue, the better the laser is going to work. For those diode users out there, you may have been maybe doing a procedure one day that had very fibrotic white tissue. Well, it didn't work very well because there wasn't much color and there wasn't much blood. It wasn't that the laser wasn't working good that day. It wasn't working because we needed to have these chromophores, or these elements that the lasers interact with. So with soft tissue lasers, we need to be thinking blood and melanin, color, dark pigmentation. The darker the better. I'm also going to put in here ND-YAG lasers. These are around 1064, and that they also interact with color, not with blood, but with the melanin, the deep dark colors. So now the next thing I'm going to put in here is water. You can see here a unique characteristic with these ND-YAG lasers is they interact with melanin and they just start to interact with water. So that's an interesting characteristic for ND-YAG lasers. Now I'm going to also, you can see here before I move on, that the diode lasers, the 800s to around the 980s, they have no interaction whatsoever with water. It's below our baseline. It does not interact with them. So these lasers have nothing to do with water. Nd:YAGs start to interact with water and also interact with melanin. Again, these are lasers that work only on our soft tissues. Now I'm going to put in hydroperoxyapatite here with along, and we'll notice it kind of follows the same waves, if you will, as water. However, over here it overpasses it. But I want to focus on right here. This is where our erbium lasers are at. Notice here at the erbium technology, it's right at the peak absorption of water. So this is erbium chromiums, anything with erbium in them there. That is right at the peak absorption of water. So anything with water in it, soft tissue, hard tissues including enamel, dentin, caries, osseous, bone. If it has water in it, it'll interact with it. And it also interacts with the hydroperoxyapatite. Then we have CO2 lasers. Notice the inverse happened here. It is at the max absorption of hydroperoxyapatite. Even though it's not max with water, it's still highly absorbent in water. So this laser will work in soft and hard tissue because there's a lot of water in soft tissues. Now, this is also thermal over here is what we need to remember. In the past, CO2 lasers did not work on hard tissues because it was just too hot. However, there is a new technology that uses a different wavelength than CO2, not the 10.6, but approximately 9.3, that does work with hard tissues as well. And I'll show you that here in a bit later. But this is important to kind of understand this chart and know what your laser interacts with. In summary, your soft tissue lasers are seeking color, blood, pigmentation. The darker the tissue, the more efficient these lasers are going to be. As these lasers, you get less and less color, less and less vascularity. They do not work as well. So we need to adjust our settings accordingly to make them work better. The Nd:YAG is interacting, seeking color, but it also interacts with water. Very efficient laser on soft tissue. Our erbiums, we stopped thinking about melanin and hemoglobin. Now we're thinking water content. How much water is the structure I'm working on have in it? Our settings are going to be dramatically different if we're working on enamel than if we're working on tissue. And those are the things that we need to learn and understand. So that's what you need to understand, first of all, in regards to absorption characteristics. And these are approximate. There are a few more, but these are the primaries. So when we look at that, if we look at some of the mediums that we have in dentistry and the wavelengths, for example, alexandrite is something that's it's not new. It's been around. We just haven't made it financially feasible yet, but its frequency doubled. It's not available to the public, but that wavelength's actually attracted to calculus. And I'm moving from lower number to higher number. That's why that one's first. But it's exciting if we can get that financially feasible. We've got gases, argons in the 4 to 500s. In the color spectrum, these are very absorbent in the melanin and hemoglobin, and they're also a resin catalyst. Curing lights are used here. Helium neon, again, another gas, great with melanin and hemoglobin, as are diodes, which is our solid here around our 800s, close to 1,000, again, attracted to melanin and hemoglobin. Nd:YAGs, I mentioned this is a 1064. Melanin and water. Then an interesting thing about the Nd:YAGs is they originally had clearance to remove caries. However, it had clearance, but it really didn't work that well. Primarily a good soft tissue laser. And then the erbiums work with water, and hydroperoxyapatite can work on all tissues. Some people call them hard tissue lasers or all tissue lasers. They work on both hard and soft tissues. They don't interact with blood or color, just the water and hydroperoxyapatite. CO2 lasers, again, very fast lasers. A new I want to say invention or use is the use of the 9.3. These primarily interact with hydroperoxyapatite and water. Now we can cut hard tissue with some CO2 lasers that are in this range right here. But this is kind of the characteristics of dental lasers. So to sum it up, diode lasers, 800 to 1,000. Again, this is an invisible wavelength. If your laser has a red light, that's the aiming beam. It's not the laser doing the work. It's delivered through an optical fiber, can be continuous wave output or gated, and it's a medium to high power. It is absorbed by melanin and hemoglobin. It's a good combination for surgeries and hemostasis. We can use very low powers. It's great for perio and hygiene. It's lightweight, they're small, and we can even do some bleaching with it. The ND YAGs have been around for a while. Again, this is 1064. It's a solid state. It's a more complex mechanism than the diodes. Again, delivered by a fiber like the diode, but pumped, and the energy is released very different. It's usually pulsed. Continuous wave is possible, but not as common. And it's got high peak powers, absorbed again by melanin with some absorption of water, and great for surgeries and hemostasis and perio as well. This laser is quite famous for a procedure called LANAP, Laser New Attachment Protocol. A bit larger than diodes, but a very good soft tissue laser nonetheless. Then we have erbium lasers. Again, it's a solid state, very complicated mechanism inside. It's pulsed only. It does not have a continuous wave option. It can be delivered by a fiber, but it can be difficult. There was some fiber problems with the first generation lasers because that's a lot of power going through a fiber. It's much easier to do through a waveguide or articulated arm, and I'm going to go over the pros and cons of those later. But again, excellent absorption by water. We can work on hard tissues, be it tooth structure or bone, and its a peak absorption is H2. Very, very little trauma or edema, but very minimal to moderate hemostasis. And then finally, the last type of laser in dentistry is a CO2 laser. These are free running, again, a complicated mechanism, a little bit more expensive. These technologies only can use waveguides and articulated arms, not fibers. They're excellent absorption by HA and water. They're very fast. They're great coagulators. They have a shallow depth of penetration, and that's why they're great coagulators. Though they're thermal, they only interact on the surface when used properly. And I say that with caution because you can have collateral damage. For those of you that are used to using a diode or an erbium, you know that you have to be a 0.5 millimeter to 1 millimeter off the target tissue. With these lasers, you can be inches off the target tissue, so the possibility for inadvertent collateral damage is there if you're not an experienced and well-trained user. And again, only the 9.3, which is a new technology, can be used on hard and soft. The 10.6, which is a majority of the CO2 audience, is for soft tissue only, a great soft tissue laser. So, what are the photobiological effects of the lasers? The first and the predominant way that lasers are used to cut historically has been through photothermal. So I'm going to show you a great example here of Dr. Omas working on a venous lake lesion. This happens to be a 980 diode. This laser is not initiated like we talked about in the last segment. It's just interacting with the blood that is in that venous lake lesion. Notice how it's going from a concave to a convex, and he has not even touched the laser. This is at 0.7 watts, very low power, and again, all he's trying to do is get the blood very viscous and thick so that when he goes in and pops this lesion, you don't see the patient's heartbeat. It's going to almost be sealed, if you will, and he's going to get those feeder vessels and it's going to coagulate. You can see here, we talked about this in the last video, he photo initiated the tip, so now it's a cutting laser. So now we're not coagulating, we're vaporizing. But again, our philosophy is to use the least amount of power to attain our clinical objectives, so we're moving in very short, quick motions on this particular procedure. And now notice when the blood came out, because Dr. Omas went over this prior at a very low setting, it coagulated the blood that was in there, so it's much easier to control. Notice how we're getting a little bit of char. That's called S-char layer. It's basically demineralized blood, and it may be black because we've hit it a few times with the laser energy, but no edema or trauma is being caused here. We're using very low settings. That's just a repetitive nature of hitting the S-char layer in this particular procedure. But you can see it gives you a good idea of photothermal effects of lasers, and you can really see that in that procedure in a great fashion. The next is photoacoustic effect. Now I'm going to show this video here. This is Dr. Rico DeVito invented this procedure, and it's called PIPS, and we're putting an erbium laser with a special tip on top, and notice how we're through this transparent tooth, it's flushing out the roots there, and what you can think of a sonic boom. And that's really what it's doing, to disrupt and ablate, to clean out that canal, that root system, to get into every nook and cranny that there is possible that wouldn't be normally possible with a traditional file. We can do it with laser energy. And literally the tip is just placed right at the base, are right at the apex and we don't move anything. Great technology. The next is photochemical. Lasers have a chemical reaction as well. This is a good example. Dr. Haddock's using a laser here, an erbium laser in this particular case. We've got a crown bonded on. It may have been canted or not seated fully. So what we can do, the crown doesn't have water or hydroperoxyapatite in it, so the laser energy, remember, will go right through it, not interact with it, but it will interact with the cement. There's some water in the cement. It'll interact with that, and it'll basically take that bond and break it, and you can see there we're able to get the crown off. So a great feature that lasers have. And then photobiomodulation. This is known as many names. Biomodulation is what we're going by now. Photobiomodulation, some people know it as cold lasers. Low-level laser therapy, that's what LLT is. Biostimulation or biomodulation. But in essence, what it is it's non-cutting. It gives you pain relief, wound healing, stimulates collagen growth. You can use this before surgery and immediately post-op. It gets the body prepared, and then post-op it expedites healing. And this may sound hocus pocus, but the science is there and the results are truly amazing. In South America, they actually did studies with open heart surgeries where they treated it with a low-level laser immediately prior and immediately afterwards, no scarring. It does expedite healing. I highly recommend that you try this laser technology. And the last thing here is fluorescence. And you're probably familiar with this with caries detection, but also cancer detection. I want to take a minute here. You can see here basically what we do with specific fluorescence when you go into the mouth. If it's cancerous, it shows up as dark instead of clear. It could be a scar. It could be a couple different things. There are false positives, but it gives us a chance. It gives us the things to look for, things to send to the lab. And I implore you, please, companies like Oral ID and others have been doing a great job. Oral cancer is the only cancer out there that is trending up. Every other cancer is going down in our society, and it has to do with detection. And we need to step up in the dental community and help with detection, and this is a great technology to do that. So some thermal effects on lasers, you'll get to know some of these things in regards to at what temperatures at different lasers we start to get coagulation. At certain temperatures we can do tissue welding, put tissue edges together and weld them together. And to cut, to vaporize, we don't want to carbonize, we want to vaporize. Trauma and edema here, and you get a feel for what these things look like and feel with different lasers. So one of four things can happen with the laser. The first one we don't want. We don't want it to reflect just like a laser pointer on a mirror. We want it to interact. It could scatter. We don't want it to do that either unless we're doing some low-level laser work. We want it to work for us, and how we do that is through absorption. We want the laser energy to be absorbed in the tissue and ablate the tissue in most cases. And if it has no interaction, like I showed you with that crown, it'll go right through the crown in that case, but then interact with cement in that particular case. And that's called transmission or refraction. So with absorption, what we want depends mostly on four things: the wavelength and the tissue composition and what is in that tissue, and you want it to interact with one of those things on that absorption chart that I showed you earlier. Most of the time, it's color or pigmentation in blood and water content and hydroperoxyapatite. The other key that we have is the speed of movement and the distance and angle to the target tissue. So if we take a look at that, and this is just one example here. A lot of people say, well, diodes don't work that good, they're slow. A lot of times it's fibrotic tissue. But as you can see here, this is very post-ortho. Dr. Sarver's using the old Odyssey 810 laser, at a setting here, and there's 5 or 6 technique keys, and that's actually quite fast and quite proficient. We don't have excessive charring. So those lasers do work. It's just understanding these components here and then how to match that speed of movement, distance, angle with the target tissue and make the right settings. Same thing with erbiums. A lot of people say these lasers don't work. This is an old VersaWave 2940 erbium lasers, and occlusal surfaces are the toughest things to cut in regards to enamel. Flat surfaces are easy. These surfaces are hard. That's actually moving quite quickly. Well, what's he doing differently there? How did he have those settings, and why did he do those settings? Once you understand that and learn that, you can get reactions like that with the tissue. So let's talk about some of these techniques keys. First of all, if we want selective ablation, we need to understand the structure you're working on and the wavelength that'll optimally cut it. And if you don't have the optimal wavelength, how do you need to adjust your wavelength accordingly? For example, if you have an erbium, your settings are going to be dramatically different if you're in soft tissue than you were in enamel, because enamel only consists of 3 to 5% water, where soft tissue is 75% water. So we just need to understand what the tissue we're in, and then make our adjustments accordingly. And how do we make those adjustments? We need to change our settings. Remember, we talked about our joules or our watts, and our pulse duration. Do we want a short pulse duration, continuous wave? Remember, we went over these in the last presentation. Is the laser always on? Is it half on, half off? Are we going to micro pulse it? Remember, some of these things are in picoseconds now. And so basically, when we get into this here, if we can have it on for a millionth of a second and then off most of the time, we won't have that thermal edema or trauma. And these lasers are a little bit more expensive, but we allow for more TRT, thermal relaxation time. So we want to use the least amount of power to attain our clinical objective. Even though this may be a high peak power, its average power is quite low. And it allows the tissue to relax, and the patient will heal quicker and faster and have a much better experience. So from a technique perspective, to get all this done, we need to then master distance, angle, and speed of movement. So one of the things that's also key here is spot size. So how big is the fiber or the tip we're using? Do we want a very big tip? This may be great for post-orthodontic hyperplastic tissue if we want to bring that down and smooth it out. Or maybe we want a laser point that comes to like a needle point, so it acts more like a scalpel. So first we select the right tip, then we've got to get our distance, angle, and speed down. How far are we from the tissue? Do we move side to side, up or down? How do we do that? If you keep it stagnant, we can get pain. So there's a lot of little intricacies for each system. So distance, angle, speed of movement. But here's the key. Each type of laser is different. I can't give you one answer for every type of laser. Each one requires a little bit different distance, angle, and speed of movement, and then requires a little bit distance, angle, and speed of movement depending on the structure that you're in. So it's not dramatic. It just takes some time to learn that. The other thing that's key is you could probably close your eyes and do a class 1 or 2 preparation. This is non-contact dentistry. So again, we're juggling these 3 things while learning the physics of it and the interaction of it. And when we do that, we get tremendous results. As you can see here, this is a cut with the laser. And if we use an erbium or a CO2, they have minimal trauma or edema, approximately 60 microns, 1 to 2 cell layers of edema or trauma. When you can do that, the patient heals so much quicker. Less postoperative pain, no scarring. It just works great when you know how to do that. Diodes are great as well. However, diodes are more of a thermal event because they're interacting with blood, hemoglobin, or melanin, and it's a little more thermal reaction. However, you only have about 150 microns. Maybe a little bit sore, but it's not bad. There's not going to be major scarring unless you're putting too much power and have black char or S-char. Then you may have 300 to 400 microns, and it'll be just like an electrosurge, and you'll have scarring, and your patients will be sore. So again, when you use the least amount of power to attain your clinical objectives, have your settings right, you can have very, very nominal edema or trauma and great results, great post-op sensitivity. You can see here, this is what I'm talking about. Like this is an example of the diode. You want this sort of light brown color. You don't want this dark black. Okay, that power setting is a little bit high. You don't want to be spending a lot of time there. You want thermal relaxation, low powers. As opposed to, you can see here, this is a soft tissue procedure done with an erbium, and it doesn't interact with the melanin hemoglobin. There is no char. You can see there's a little bit of oozing, but look at you can see the vascularity and the little fibrotic tissue right there. I mean, there is hardly any trauma or edema. That patient will heal great. Same thing on tooth structure. Look at their microfracturing happens with the friction of a handpiece. With the laser, it's non-contact. It's an ablation on the surface. No microfractures like here we have on the bone. We don't have that with a laser when we use the proper settings. Some new things coming out, PIPs, photo-induced photoacoustic photoacoustic streaming for endocanals. We can go in now non-contact using this photoacoustic effect, and look at this. I mean, this is at 10 and at 2 microns. I mean, just look at how beautiful that is. And now in the future, look at how some of these lasers, remember I talked about that frequency doubled Alexandrite, which is not available yet, but look at how that's selective to the calculus and doesn't do anything to the tooth surface. So amazing technology, and when you master it, it truly can be amazing for you. Now, what our goal is here is to provide patients with a better experience, and you, the doctor, to feel more confident doing more procedures, adding revenue to the practice, bottom line. And you can do it when you master the keys and understand it. And you think of lasers are more conservatives. It's microdentistry, one cell layer at a time. A good word to have in your head and even in your patient's head at LASIK surgery. Very, very precise. Creates a secondary wound, not a primary wound. You're not going to have scarring, inflammation, swelling, seals and lymphatics and nerve endings. You can do a lot more with just topical. The body's signaling system isn't going out and sending pain signals, getting that swelling and getting the lymph system jacked up. So we have a nice dry field to work with. It's easier. Bactericidal and cross-contamination reduction, great for periodontal pockets. We've got our photo biomodulation, which stimulates healing and growth. We have anesthetic properties with restorations. Patients appreciate it if you can do procedures without anesthesia and numbing them up. Does it work for every procedure? No, but it can work on a lot of procedures, and we can get into more of that in more detailed presentations down the road. Make once difficult procedures easier and more predictable. That opens the door to new procedures. We talked about that PIPS procedure, for example, a lot easier than traditional endo and file. So that open, and maybe even like that Venus Lake procedures. There's many procedures like that to help you become more profitable and optimally treat your patients and keep them in your doors. So hopefully this has been helpful for you. Again, this is presentation 2, talking about laser tissue interaction. Note that on the subscription site, we get into much more detail and talk about multiple procedures in detail with different technology, interactive blogs, detailed videos, again, with different types of laser interaction. So we have much more of that on our subscription site. So with that, I'd like to thank you for your time.